there is a question about how do you optimize sleep if you're suffering from diabetes and high blood pressure? Is there something you have a suggestion about the optimization of sleep?
So diabetes and hypertension, I don't know if they affect the quality of sleep in the night, but maybe in other forms. For example, if you are diabetic and you're not properly managed, and then you have to wake up to go to the bathroom 3 or 4 times in the night, and then you take about 30 minutes to go back to sleep, then that's not optimal. So you want to have a good control of diabetes. On the corollary, if you have sleep apnea, there's one of the diseases which we see, and everybody talks about sleep apnea nowadays, but nobody talks about circadian rhythm or the insufficient sleep in the night, which is about 8 hours, and sometimes people sleep. We Americans tend to sleep just about 4or 5 hours and work 2 jobs and social life and this and that, all that put together. So if you don't sleep your 8 hours, and if you have diseases like apnea, that leads to poor control of diabetes. So hemoglobin A1C, I'm sure the questioner would have this concept of hemoglobin A1C, which is measures your hemoglobin or your overall control for the past 2 months. If that is high, then it suggests that maybe there's a chance that he might have sleep apnea, which also leads to hypertension, and diabetes control is poor. So about 50% people with diabetes and hypertension have sleep apnea as a comorbid condition. So I would suggest that maybe look for sleep apnea, maybe increase your sleep time to about 8 hours, if not eight, at least 7 hours on a daily basis, and try to make it consistent.
Okay.
That would be my suggestion.
There's another question which is, I think, probably going to be shared by a lot of people, and this is about not sleeping well because there is all kinds of weird thoughts going in your head which have no direct relevance to your life, but they happen to create the disturbance that you cannot have a sound sleep. What are your thoughts on that?
Wow, this is something where I think Sachin will be able to help. So I think the ability to stop your mind is, I can easily say that, okay, just stop thinking about processes. That's what I tell my people. Don't take your work to bed. Don't take your smartphone to bed. Don't start listening to things. Don't worry about your boss, what's going to tell you tomorrow. Don't worry about what's going to happen to things. It's going to happen anyway. So I think don't take your problems to bed is easy said than done. But I think learning to how to do that, meditation, soft music, there are millions of apps out there, or sleep songs or sleep lullabies or water sounds, and whatever suits your fancy. I think the thing would be to not think about problems. You decide among yourself as to, I don't want to take my problems to the bed. I don't want to think about things till tomorrow. Uh, you can't solve the world hunger problems. So why worry about it today? Let's do it. Let's think about. Let somebody else worry about it. At least get your 8 hours of sleep on a consistent basis.
And would meditation or something before you
Definitely
go to
helps.
sleep, would that help?
Definitely helps for sure.
So the
And
other
I'm not
question
qualified. Yeah.
here, which has come in, is kind of an inverse of the problem of having to sleep, that you're sleeping too much. That is that how that can be corrected?
So sleeping too much is what we call as hypersomnia. Hypersomnia has got many issues. Many reasons can cause hypersomnia. As I said, your average sleep time, if I map, so there's something called bell-shaped curve. I don't know how many of you know, but bell-shaped curve simply means that if I take 100,000 people and I say as to how many hours does all this 100,000 people sleep, I would hit a target at 8 hours on a general basis, and that's a tip of the bell. But there are some people who will be sleeping and happy with just 6 hours of sleep. And then some who is going to be other end of the tail, which is going to be sleeping 10 hours a day in 24 hours. But in all said and done, we accept that this norm of sleeping about 7, 8 hours in the night is considered to be normal throughout the world. And if you sleep 9 hours and you think that's what you need to function, maybe you are a long sleeper. So there's a separate CPT code for long sleeper as well as short sleeper. So it's possible that you may be a long sleeper, but more often than not, if you are telling me that you sleep instantly, sleep is not a problem at all. You go to bed at 8 o'clock in the night and you wake up at 10 o'clock in the morning and you're perfectly fine. Sleep is not an issue. And that is actually an issue because you're sleeping 12 hours in the night. So why would that be? So most common problem for people who are having hypersomnia is what we look for as sleep apnea. So sleep apnea simply means, because it's coming second time, I want to say two lines about that. So sleep apnea simply means you're closing your airway from inside, and that can happen like maybe more than 5 times an hour is called as abnormal. So if you're closing your airway, so total open airway versus totally closed airway is called apnea. But there's something called hypopnea as well, means less air going through, or airway is partially narrow, and that less air going through and all can cause the body to react as well. So each time you do that, each time your airway is closed because of collapsing of the airway or because of structural abnormality, that leads to less air going into the body. Body goes into the panic mode. The adrenaline system responds, and that wakes you up. You have to wake up to have that. Otherwise, the body keeps on fighting. And that's where the hypertension happens, the arrhythmia problem happen, heart attack happens, reflux disease happens, muscle pains happen, joint pains happen. I mean, I can go on and on and on. All these issues are linked because the body is fighting at that moment. And to relieve that obstruction, you have to wake up for a few seconds. And this happens hundreds and thousands of times each night. And that leads to daytime sleepiness, or you sleep longer to be feeling better. To get your 8 hours sleep or get your deep sleep or REM sleep, you need to sleep longer period of time. So hypersomnia is the main cause is sleep apnea, but then other causes like narcolepsy, for example. Maybe you're kicking your legs a lot in the night. We call that restless leg syndrome or periodic leg movement disorder. Maybe you have idiopathic hypersomnia. Maybe you have reflux disease. Maybe you have asthma. Maybe you have psychiatric issues which are being controlled. So all these, if you type hypersomnia on Google browser, it's going to show you all those things which I just now talked about, and many others, of course. So it's a good idea to have it checked. I would start with sleep apnea management, evaluation and management first. That's the first step.
And what about these machines which you use for sleep apnea and the difficulty one has to use this machine and try to sleep? Uh,
Just get used to it. I
just
think
get
I
no way out of it.
no, I can tell you that this is one of the best things which has happened to mankind. Being a sleep specialist, I can tell you that after the wheel, I personally feel. I mean, I'm a critical care specialist, and I'm a pulmonologist, and I'm also, as so mentioned, I'm an MBA as well. I've seen a lot of problems and S-bar methods of dealing with things, but I think this is one of the best things which has happened to mankind. The easiest way to keep this open is to not sleep. But as I said, we need 8 hours of sleep. So one more method to do that would be you can come to my office every evening and I can put a tube down your throat and I can, you can breathe. You can bypass that closure I was talking about. And that closure is easy said and done, but coming every evening and you can take the tube out in the morning. Or there are 30 other things which are people are trying outside. And everybody is trying to Bhaiti Ganga mein haath dholo types. Everybody is trying to find money way out of to how to make money on this huge pandemic, much more than I think half the world has this issue. So coming back to point, CPAP machine is easiest thing to do. Like for example, I give example, I cannot see now. And I cannot see, I can live with that if I decide to, or I can put these glasses on and I can see very clearly. So I hate these glasses, but I cannot see without it. So the mask, all you have to do is to find the right mask which fits you. If you're a size 9 shoes and you put size 8 shoes or size 12 shoes, it's going to be uncomfortable. So more often than not, I see people in the community where they have not been taken care of very well. Here is you have sleep apnea. Here's a machine. Okay, I'm done with you. My job is done. I made my money. I don't care about you anymore. And that's the problem. Which and half the people they are not ready mentally. They're not prepared to use the machine because it takes 5 minutes of extra effort in putting the tube on, the mask on, give the machine cleaning in the morning and all that. But there have been patients, once you educate them about these and then the association of their arrhythmias and hypertension and diabetes, along with these problems, they tend to accept better. So in my office, the acceptance rate is about 85% compared to the data out in the world is about 55%. So I would suggest us get used to it, please.
Right, right. Now, it's a slightly different topic here about melatonin, CBD, and other supplements which are out there in the market. Uh, what are your thoughts about that?
Any specific question on that, or do you just want to use the melatonin to help you sleep? What's the question?
Yeah, the question is, is it, first of all, use of these items, melatonin or other supplements, is that advisable, not advisable,
So that again depends, and that's why there's a whole sleep medicine specialty. So just to summarize, maybe in 2 lines, sleep aids are not good. Okay, but then there are certain conditions where you need it. Acute adjustment disorder, for example. If I have a death in the family, or if I am like having some acute events which are affecting my sleep. For example, if I lost my job, or moved, or have to do things, I have to present the paper tomorrow, stuff like that, then I need something to help me sleep. So that is something where I tend to give sleep aids for maybe a couple of weeks, maybe a couple of months. If somebody is having a hard time tolerating the CPAP machine, I've used that as well. But I tend not to give sleep aids because most of these sleep problems in the night either are circadian rhythm issues. If an elderly person, for example, coming back, 70 to 75-year-old man coming to me and saying, I just can't sleep in the night. Well, let's solve the problem. Oh, I get up at 2 o'clock in the morning and I can't sleep through the night. What time you go to bed? I go to bed at 7 because I feel very sleepy. So you go to bed at 7 and you wake up at 2 o'clock. You already got your 7 hours sleep. What do you want me to do? Maybe you should not take any sleep aids to go to bed at that time, right? So that sleep aid is not good for this gentleman. And if you take a sleep aid, any of those PAMs, diazepam, clonazepam, and all that, any of these PAMs, they actually tend to make you drowsy and you affect your cognitive behavior in the daytime as well. And that's why it's contraindicated. So any of these sleep aids, and let's say if you have sleep apnea, which is not diagnosed, and when you have that closure, and I told you that you wake up for a few seconds to open this up, and then you go back to sleep, and then you close again. And that's a game you play all night long. So each time you close, let's say 10 seconds later, I'm going to call this an event only if it lasts for 10 seconds. We call it apnea events. There's a definition criteria for that. Let's say if you're waking up, but you take your medicine not to wake up because you're waking up too many times in the night and you're not sleeping enough. Now, guess what? You're dying for a longer time. And if it lasts for a minute and a half, 2 minutes, you're dead. So I think it's not a good idea to take sleep aids because that leads to a longer events, that leads to a more of a problem. It's a natural process, so let it happen. So I think taking sleep aids to bring in sleep is not a good idea. I would rather have some kind of a psychological behavioral changes. Sachin can help with that, or any of those, um, fixing your sleep cycles, fixing your sleep hygiene issues, fixing your circadian rhythm. I think those are more important identification wise and implementation, find a solution for those than taking a sleep aid. As far as melatonin is concerned, melatonin is not a sleep aid. It does not bring in sleep. It actually modifies your circadian rhythm a little bit. So I use melatonin to help people come back to the synchronization. Let's say somebody goes to bed at 4 o'clock in the morning. I want to bring him back to 11 o'clock in the night. So I use melatonin in certain time zones. So if we say you need to take a melatonin 3 hours before before the time I want him to sleep, to get his cycle back into place. So that's what my take would be on sleep aids.
All right. How many hours of deep sleep is good, or what's your thought? What are your thoughts on that subject?
So just about to type that answer. I was looking at the question from an anonymous attendee. Well, so as I was talking about the physiology of sleep, the non-REM and the REM sleep. So the REM sleep normally is anywhere between 15 to 25%. So if you take 25% of sleep, that's the upper end of normal. Then the 75% of sleep is in the non-REM sleep, in which the deep sleep again is about 18 to 25% as well. So about 25% of sleep is deep sleep in general. As a child, maybe a toddler sleeps about maybe 30% of sleep in deep sleep. The deep sleep changes less as compared to the REM sleep. An infant sleeps about 50% of sleep time in REM sleep. But as we grow older, we about sleep just about 20-25% of REM sleep. So REM sleep decreases more as we age compared to deep sleep.
Right. And there's one more question which relates to applications you have on smartphones these days. There's one application I didn't know about it, but it tracks how long do you scoff or you have kind of disturbance at night. Uh, any your thoughts on that subject about use of these apps and how do you correct the situation if you're coughing too much at night?
So all these apps which I know of, they basically use few of these available gyrometer and spirometer and other things to measure how much time you spend quiet time. So generally they're worn in the hand or the wrist. So you move your hand when you're awake, you move your hand a lot in the daytime, right? If you're quiet, if you sleep, you're quiet. You're not moving. So these machines are designed to track that. And they're going to tell you a kind of a analogy. Oh, you went to bed at 10 o'clock on Monday, but 12 o'clock on Tuesday, and or you wake up at 6 o'clock in the morning, your movement started again at 6 o'clock in the morning. So it gives you amount of time you sleep in the bed every day. So that's fairly okay. But it does not. So those apps which talk about REM sleep or deep sleep, I would not buy that at all, because that's no way to measure that to the hand. There is a Kaiser Hospital does that device called WatchPad to check for home sleep study. It also gives you the REM sleep in that, and that's again one on the hand and with a similar concept. And it measures that REM sleep depending on the tone of your blood vessel, the radial artery. So it actually depends on that. Some of the publications are there, but it gives you there is 80 to 90% correlation with that. I don't think you can say that you woke up because of cough, or you woke up because of reflux, or you woke up because of asthma response, or you woke up because your bed was not right, or you woke up because your partner was snoring. But it will measure the amount of time you actually were restless in the night. So it will give you that information. So you have to figure out why that sleep was just about 4 hours last night. Oh, I was watching a movie until 2 o'clock, and I woke up at 6 o'clock. So that's why I had 4 o'clock, 4 hours of sleep. It's not because it will tell you, oh, you were, doing something else. So it will tell you that you slept only 4 hours. So we had to deduce that information as to how we can modify. So these apps are good for screening, good for telling you as to what you need to mend. And I think that's where I would rest my case.
Thank you so much for all your insight that you're sharing with us.
Sure.